Hello, I am Dr. Shibasi Sahu, Professor in Cardiology in UNMICRC Institute of Cardiology and Research Center, Ahmedabad. I will give a topic on exercise paradox of sudden cardiac death in young adults. So what is sudden cardiac death? That is defined by natural death from cardiac causes, where there is abrupt loss of consciousness within 1 hour of onset of acute change in cardiovascular status. It is not a single disease entity, rather a terminal event of several diseases. It is not limited to cardiovascular pathology only. It is one of the largest causes of mortality globally, where there is more than 90% die. Out of hospital survive only less than 10% despite of best of the resuscitative care. Therefore, it is an important public health challenge for all of us. So, what is exercise paradox for sudden cardiac death? As we know, regular physical activity improves survival. However, in young adults, what happens in untrained, non-conditional intense exercise, there occurs sudden cardiac death. That is what is called as exercise paradox for sudden cardiac death. Most of them have previously unrecognized cardiac disease. Overall, the risk is low, it's around less than 2 per 1 lakh population per year. Recently, a spot in the incidence of sudden cardiac death in young adults during exercise is observed in our society. So, what are the causes? Before jumping into the causes, I will tell sudden cardiac death is not synonymous with heart attack. There are several causes of sudden cardiac death, and out of which heart attack is one of the causes. So, it is not synonymous with heart attack. So, what are the causes? I have divided into two groups, more than 35 years of age, where there is atherosclerotic coronary disease is the most common cause. What happens? During intense, untrained, unconditional exercise, there occurs sudden surge in catecholamines in the cardiovascular system. That gives rise to acute rupture of lipid-rich plaque inside the coronary artery, subsequent coronary artery blockage and heart attack. This is a possible explanation. And in less than 35 years age group, the most common cause is inherited cardiac muscle disease, what is called as hypertrophic cardiomyopathy, and second is infection and inflammation of the cardiac muscle, myocarditis, particularly viral myocarditis. During viral epidemics like viral upper respiratory infection or viral gastroenteritis, and that virus also affects the viral myocardium that predisposes to viral myocarditis. Clinically, viral myocarditis is not recognized many times, and suppose one individual is suffering from viral URTI, viral gastroenteritis, that individual may harbor viral myocarditis also, because most of the time the symptoms are innocuous or they are asymptomatic. So, if that individual pursues intense exercise during that period, that individual might develop sudden cardiac death. The third is congenital coronary disease, where there is anomalous origin of coronary artery, and second is myocardial breach also. And next is coronary dissection, particularly that is seen in pregnancy, during labor or in the postpartum stage in young females. And lastly, coronary spasm, particularly in drug abusers like cocaine, taking drugs during exercise, and that also causes coronary spasm and sudden cardiac death. And less common causes are particularly diseases of the cardiac electrical conduction system. First, there is most important cause is long QT syndrome. What happens during intense exercise? There is dehydration, loss of electrolytes, particularly potassium, the hypokalemia, that also gives rise to long QT and predisposes to ventricular tachycardia and fibrillation. And taking liquid protein diet before exercise also predisposes to long QT syndrome and subsequent VT and VF. And second is early repolation syndrome. Yes, early repolation syndrome is very much prevalent in our society, but when early repolation syndrome is present in inferior lateral leads and more J point elevation, yes, that can also give rise to ventricular tachycardia and fibrillation. In one study, it is found the incidence of cardiac arrest is around 140 per 1 lakh population per year. Definitely it's alarming. And in another study is also there is an association between this early repolation syndrome and higher mortality during acute MI in young adult has been reported. Next is Brugada syndrome, another is catecholamic polymorphic VT, that is CPVT. They are all inherited electrical conduction system disease of the heart. Next, another cause is dilated cardiomyopathy, where the heart muscle gets weak, unable to pump the blood. And next is arrhythmogenic right ventricular cardiomyopathy, and next is acute massive pulmonary embolism. Then some valve disorder like mitral valve prolapse and bicuspid aortic valve, they can all predispose to ventricular tachycardia, fibrillation and subsequent sudden cardiac death. So what are the non-cardiac causes? Acute stroke, epilepsy, they can also predispose to ventricular tachycardia, fibrillation, sudden cardiac death. Then next is heat stroke. Exercising in hot, humid condition, often with athletic gear, that impairs heat dissipation and predisposed to heat stroke. The internal core body temperature increased, that also gives rise to ventricular fibrillation. And second is drug use, particularly cocaine, that also causes cutaneous vasoconstriction, that also predisposed to that also causes impairment in heat exchange and also subsequently turn to heat stroke. So what are the mechanisms of sudden cardiac death? First and most important is ventricular tachycardia that culminate into ventricular fibrillation in more than 80% cases, and in the rest 20% cases it is pulseless electrical activity and primary asystole. So how will it address this challenge of sudden cardiac death epidemic? I have come with a framework of 3 concepts, that is RUP. R means respond, U means understand and predict, P means prevention. Then comes first is that is R, that is respond. Most sudden cardiac death victims, they are unaware until their collapse. Sudden cardiac death is not as sudden as that is typically defined. 75% of the victims, they have early signs, but more often they overlook those symptoms. So what are the early signs? Early signs and symptoms are like chest pain, shortness of breath, giddiness, blackouts, nausea, vomiting. So you should recognize before developing sudden cardiac death. 75% victims have early signs according to one study, and those early signs last for 20 to 30 minutes in a study from Germany. So next is improvement in the resuscitation alert system for warning signs of sudden cardiac death. In that, public education is the key. Emerging digital technology is also helpful. It's better to develop one mobile app that will transmit event and location data of the victim. Then you can apply GPS service to coordinate between fast responders and EMS team. And next is improve access to defibrillator. So where you will keep defibrillator? In your office? In your vehicle? No, it should be as close to the community as possible, so that place time mismatch should be curtailed. Then very important, that is improve fast responder rate. This SCD typically occurs in the presence of bystanders. More critical than defibrillator availability is improvement in the fast responder rate. So training and education of public regarding this cardiopulmonary resuscitation is top priority. Then comes B, that is understand and predict. You have to understand what is the cause of sudden cardiac death, what is the pathophysiology behind SCD, and what is the mechanism fast. You can also rescore for prediction of sudden cardiac death in an individual, in a community also. For general population prediction of sudden cardiac death, there is one score that is called as ERIC score, and for coronary disease where there is more than 75% stenosis, there is one risk scoring calculator, that is deep SCD risk score calculator. In that scoring calculator, you can risk score the susceptibility or the likelihood of developing sudden cardiac death in an individual. Next is societal development of one registry for sudden cardiac death for better understanding the challenge of SCD. That registry should be prospective and community based, and the registry should include autopsy and postmortem genetic analysis also. And recently what is called as non-invasive autopsy, that is postmortem imaging to detect the mechanism using MRI, CT, that can also be helpful. That is called as non-invasive autopsy. So lastly, that is prevention. All individuals of society are stockholders for prevention of this epidemic. That requires greater public awareness, societal debate and focused public policy. You should identify at-risk individuals who will develop sudden cardiac death. How can that be done? We should identify who are the sudden cardiac death survivor first. Then next is who are the family members of sudden cardiac death victim. So you should subject them to comprehensive cardiovascular exam and should assess for exercise fitness in them. Then you can create one digital infrastructure. How that can be done by continuous biometric data and using analytical tools like artificial intelligence for better understanding who are the at-risk individuals. Then you shouldn't ignore the warning symptoms and signs. Avoid denial phenomenon. Identify and control your cardiometabolic risk factors. Adopt healthy lifestyle. Now that is our international chair on cardiometabolic risk factor prevention, they have advised 4 things like eat well, drink well, sleep and take rest well and move. Do not forget those 4 things. And lastly, mental stress. How you decrease or avoid mental stress? Just practice mindfulness. So what is mindfulness? Mindfulness is non-judgmental awareness of one's own present thoughts, behaviors. So how can that be practiced? That can be practiced by traditional yoga, meditation, pranayama and behavioral therapy. That is the main aim of mindfulness is how you carry yourself, how you respond to your emotional response and behavioral response to day-to-day life challenges. Thank you.